It all began here at this live food market in Wuhan, China. A mysterious virus born in its shops, triggering a wave of illnesses. The internet soon filled with pictures of hospitals at breaking point, and the body bags piling up on buses. Images brought to the world by citizen journalists risking life and liberty.
I'm not even scared of death. You think I'm afraid of the Communist Party?
China scrambled its massive resources in the most ambitious containment efforts ever seen.
This is something all Chinese people are involved in. Each person will pitch in and will play their part.
Health workers from across China headed to the front lines of the outbreak, putting themselves in harm's way.
Of course we're worried, and so are our relatives. But we're nurses and will do our job as long as we wear the uniform.
The scope of China's response is unprecedented. New medical centres built in days. Universal temperature monitoring. Controversial strict social distancing rules that included locking down a city of millions, helping to stop the spread. And meticulous contact tracing. In Wuhan, 10,000 epidemiologists aggressively traced every person that a coronavirus patient had been in contact with. Hundreds of thousands were tested at fever clinics like this. Scientists returning from a fact-finding mission praised the efforts.
Folks, this is a rapidly escalating epidemic in different places that we have got to tackle super fast to prevent a pandemic. I mean, it's actually, what China demonstrates is where this goes is within the control of our decisions to apply this kind of rigor and approach to this disease.
Experts say the China playbook is a blueprint for the world, but the question is, can they and will they follow it?
Professor Dale Fisher is from the National University of Singapore, and he was part of the WHO team that visited China in February. Professor Fisher, thank you for joining us. The report commends China for the kind of response it had to the coronavirus outbreak. My question to you is the world ready to follow the China playbook?
Well, that's a good question, Birish. In fact, one of our comments was that we had major concerns over whether the world was ready. Some of the interventions that were required in China really required a lot of community engagement and a lot of thoroughness, speed, decisiveness, and we thought some countries could struggle.
Would you like to name these countries? Is most of the world ready to follow the China response?
You know, the world is full of countries with completely different contexts. So you know, I think the countries that are being taken by surprise are you know, the ones with many cases at the moment. You know, in many ways are the unlucky ones. They were the first ones tested, and more now that people can see what happened in Italy, which is not completely different to what happened in Wuhan. Compared to what's happening in Iran, South Korea. You know, these countries were tested very early, and other countries, I think, have got the opportunity to learn from what happened in China, but also from what's happening in these other countries, and try and have the preparedness in place so that they don't follow likewise.
Much along the lines of China, Italy has effectively imposed a nationwide lockdown. Would you say that based on the current situation of the number of cases worldwide, that there are other countries that should have potentially imposed a lockdown by now and they haven't?
It's really about whether you're able to bring in the interventions. One of the major interventions is early case detection. And identifying the contacts and being able to follow them up closely enough so that if they become cases, then we can stop that chain of transmission because they've been identified early and indeed in many cases isolated even before the symptoms began. So you need to have sort of these more drastic measures such as lockdowns, I think, when the number gets to the point that you physically can't track everybody anymore. So it's like, stay still because we can't follow you.
What would that number be?
It completely depends on the context, the resources, the size of the country, the mobility of the population. If you know, I would argue that Europe's a very mobile population. There's a lot of easy transport, and it really wouldn't take, and indeed hasn't taken long for it to spread across Europe. So there does get to a point where you just have to ask people to stay home until we can control the spread.
How would you rate the European response so far? As you correctly point out, mobility within Europe is another matter compared to, say, some of the other countries in the world. Border controls don't exist. Would you say the European response has so far been satisfactory?
I wouldn't like to say it's been satisfactory or unsatisfactory. You know, every country has different challenges, and China has the capacity to act swiftly and with great sort of decisiveness. Other countries have to work with their population, and while some countries may like to make these decisive decisions early, the population has to be ready for it to be accepted. So, you know, I wouldn't like to speculate on the timing, but, you know, clearly I think, as opposed to a few weeks ago, the world is much more awake, and of course we might have preferred that the world was more prepared a couple of weeks earlier, but, you know, it is what it is, and now you have to act. You know, China bought the world a lead time, and different countries use that lead time to varying degrees. This was declared a fake on January the 30th, a public health emergency of international concern. The WHO can't scream louder than this is a fake. And I think, and I hope, countries were moving as quickly as they could from that time to be prepared.
Would you say countries are moving as fast as they potentially should have been?
It's difficult for me to say. You know, I'm not in all those countries. I think some countries, as you know, I live in Singapore. This country moved very swiftly to implement, and by the time we had cases, all our major hospitals could do testing. We were able to pull on extra support to do the contact tracing. We had quarantine, you know, the capacity to quarantine people with and electronic surveillance systems. You know, these could be in place to make sure people were adhering to their quarantine. I know because when I came back from China, I was in quarantine and I was getting twice daily phone messages that I had to answer, where they could locate my phone to make sure that I was in my address. So these simple measures are in place in some countries. Other countries might have to do them a bit more manually, but this is the preparedness I'm talking about. You know, for some countries, it would be very challenging, and I can see them all scampering. I don't hear as much bravado and discussion like that anymore. I think every country is now taking it very seriously.
Just as a final question, if there were certain measures you would recommend to governments around the world, which would those measures be that should definitely be followed in the event of coronavirus outbreaks? So
it might surprise you to hear my answer, but to me the biggest measure is community engagement. If the community is not on board with the response, then this can't be worked. The solution is in the community, and that's because spread occurs through the community. And if people don't have that sort of social responsibility to be part of the solution, then any government is going to struggle. Governments need to provide the contact tracing and the overall surveillance, the enhanced approach to testing, the easy availability of testing, ideally free testing. But governments can do that. But it's the communities that need to have to say, okay, when I'm sick, I'm not going to go out. But if I do have to go out, I'm going to wear a mask and I'm going to cough into my elbow and I'm going to wash my hands frequently and I'm going to stay away from people as much as I can. And I'm not going to go indoors to large gatherings, because that's where a lot of these sort of larger outbreaks occur.
Professor Dale Fisher, we'll have to leave it there for the time being, but thank you so much for joining us.
My pleasure. Thanks.